Hello everyone, welcome to VojdaniU episode 6. This is our video informational series where we pick a different topic and talk about the latest exciting news in relation to autoimmune and autoinflammatory diseases. And my guest, as always, is my father, Dr. Vojdani. Thank you for being here.
Thank you, Elroy.
He's known by many as the father of functional immunology and really is a tremendous wealth of resource when it comes to everything related to the immune system. So I'm really excited because in our episode today and our next episode, we're really going to be talking about Alzheimer's disease, which is such a big topic because it's affecting so many people in the United States. And we have recently published in our time between our last episode 3 new journal articles in relationship to Alzheimer's disease and really what we can do to figure out how to discover this disease before it starts its devastating effects. So I'm going to open up with you, Dr. Vojdani. Tell us what inspired this research.
Yeah, first of all, how pleased I am working with you, Elroy, because I'm a scientist, but you are the MD and you have the clinical experience. So during past 5 to 10 years, unfortunately, I have seen many individuals who developed early Alzheimer's, signs of early Alzheimer's or full-blown Alzheimer's disease. And you feel the pain of Alzheimer's, not only in the patient, but in the people who are surrounding the patient.
Absolutely.
And so therefore, today we are going to discuss that there is hope. There is something we can do about this. Up to 3 years ago, I thought Alzheimer's disease is devastating disease, and maybe there is some medication that we can take to prevent it. But as you know, as a clinician, today that's not true. Almost none of the medications which are in the market are not they may treat the symptoms, but they cannot cure the disease.
Absolutely.
And so therefore, our message is a message of hope. So I learned from you. Thank you so much for that. During past 3 years, I feel as if I had my second PhD in the field of neurology, particularly in the field of Alzheimer's disease.
Yeah, things are very exciting in the world of Alzheimer's disease because, as you said, up to a few years ago, this was a diagnosis that was devastating. It affects everybody in the family, not just the patient who's afflicted with the disease. Caretakers are involved, and it's a very difficult downward slope for everyone to observe, and also, of course, for the patient themselves to go through. And there was really no answer that anyone could provide in the medical community. As you alluded to, hundreds of drugs have been in development by all the major pharmaceutical companies looking at one way to kind of attack and fix Alzheimer's disease. This is some clippings from the Wall Street Journal that you provided with me the other day, which is a really fantastic piece, really talking about AstraZeneca and Eli Lilly now canceling their latest drug trials in their attempts to cure Alzheimer's disease with a pharmaceutical drug after spending billions of dollars in development for those 2 drugs. And these are just the latest 2 in a line of hundreds of failed drug trials. So, that has caused many people like yourself, pioneers in the field of immunology, to start looking at this disease in a very different way. And you and I attended the Institute for Functional Medicine's annual conference last year, which was really all focused on Alzheimer's disease and neurodegenerative disease, and we said, we have to get involved in this.
So, Elroy, as a clinician, what do you think about why this failure? Why the field has failed so far?
Yeah, I think the traditional pharmaceutical treatment approach to Alzheimer's disease has failed because it's been very narrow-minded. We've had the pleasure of meeting, speaking, and doing a little bit of research with other pioneers in the clinical field of Alzheimer's disease, like Dale Bredesen and Dr. David Perlmutter. And they really are the people who have been behind, with yourself included, and Dr. Tanzi from Harvard also included, behind changing our mindset as to what causes Alzheimer's disease from one process to opening up that box and maybe exploring other ideas that Alzheimer's disease is the end symptom of many different processes, many different abnormal processes. They can all end up exactly the same way, but for each person, what took them to that final place is different, right?
So what you are telling us actually is this, that there is no such thing as one factor, one disease, in this case, a single factor as a cause of Alzheimer's disease.
Absolutely.
If that's true, maybe that's the reason we are failing, because if the disease is multifactorial, by trying to treat with one medication, then maybe that's the reason we are failing.
Absolutely. And I think the other very important new thought process that has come out with Alzheimer's disease and other neurodegenerative diseases is that a recognition that by the time you diagnose Alzheimer's disease, the process has been going on for 20 years at that point. 2 decades worth of this disease where damage is being done to the neurons in your brain. And if you intervene at that point, you might be able to slow the progression of the disease and give the patient some quality of their life back, but you can't do anything meaningful in preventing it or reversing it, so you can't cure the disease.
Yeah. So what you are telling us that there is a message. Your message is a message of hope. That Alzheimer's disease that we see today started almost 20 years ago. And so therefore, we can intervene and prevent Alzheimer's disease.
Absolutely.
So right now, we have to talk to young individuals, 30, 40, 50.
Yeah.
And so please elaborate about this.
So I think really the force behind our motivation to get involved in the field was understanding that this is a process that occurs for maybe 20 years until symptoms are felt by the patient. Like many other autoimmune diseases, there is a clinical phase where things are going on but no symptoms are present. So we decided to look into what we can do to detect this disease at that point 20 years before the damage is done, so you can fix the issue at its root cause and make sure that the disease doesn't progress to its devastating end product.
Yes.
Right?
Absolutely. So this was very elegantly presented in the journal called Scientist, right?
Yep.
Scientist. And one of the most famous surgeons, right? Keith Black,
Yeah.
from Cedars-Sinai.
Yes. He's
Who's
the
the-
chief of neurosurgery at
exactly.
Cedars-Sinai.
He's telling us that Alzheimer's that we see today started 20 years ago. And so again, we can do something about it.
Right. My analogy to this is something that I think most middle-aged people are very familiar with. You know, once we turn 50 years old, we start getting colonoscopies to make sure that we catch precancerous lesions in our colon before they turn into something more severe. You go through that routine surveillance, and Dr. Bredesen actually coined something called the cognoscopy, where starting at 50 years old, you start getting some workup done to look for all these things that we're going to talk about contribute to Alzheimer's disease, and make sure that you remove them from your environment and you prevent the disease from actually occurring.
Yeah. So for this, together, we prepared our V factor. So
Yes.
please explain what is V factor and why we are doing this.
Absolutely. So the V factor as it relates to neurodegeneration is something that we came up with to kind of explain both sides of the coin. That on the left side, we have all the things that in combination can contribute to Alzheimer's disease occurring, the left side, so the downward spiral. And then on the right side of the V factor, we have all the things that you can do, all the things that you can incorporate in your life to prevent and protect against something like Alzheimer's disease occurring, right? So on the left side of the V factor, we start with something so important to all kinds of diseases, is the idea of oxidative stress, right?
So we are going to go through these steps one by one.
Mm-hmm.
The first one is oxidative stress. So let's simplify this for the audience that the brain, if you are healthy, it looks like a healthy forest. In order to have a healthy forest, what do we need to do?
You need clean water, you need air, you need food, you need all of that.
Yeah. So everything, when all the nutrients, all the good environmental factors are provided, the forest is absolutely green.
Great.
Right? But when oxidative stress happens, lack of nutrients, lack of oxygen, all of that, what will happen?
Sick forest.
And so we can make that analogy to our brain as well. So when our brain is exposed to so many environmental factors, unfortunately, this is, again, this is the healthy brain. You see how the neurons, everything functioning, and you are the clinicians.
Yeah.
Please, you want to explain this a little bit
Well,
more? Just go ahead.
Yeah, you're alluding to the fact that if you give your brain and the cells in your brain the things that it needs and it doesn't have any of the damaging chemicals, then it grows just like a beautiful garden would in your backyard.
When Alzheimer's happen, unfortunately, due to all these factors, which causing oxidative stress, on the top right here we have the pathogens. And we are going through the pathogens causing oxidative stress, inflammation, autoimmune reactivity. We will talk about that. That's why we have binders of articles that we would like to share with you, because this is evidence-based presentation.
And that's why we have you here to explain that to everybody.
Thank you. And so pathogens, infection, and then you have the toxic chemicals such as aluminum, formaldehyde, mercury, pesticides, all of that. When we have surplus of that in the brain, causing what? Cell death, destruction of the neurons. Some food that we may react to them, and antibody against that may turn against our brain. And we'll show that in the articles that we published in the scientific journals.
So I just want to clarify the focus of the research that we've done in the last year and that we've published since VojdaniU episode 5 and 6 are really focused at figuring out exactly which foods, which chemicals, which infections contribute specifically to the oxidative stress that occurs in the development of something called beta amyloid, which is the protein that gets deposited in the brain that causes Alzheimer's disease, right?
Yes, yes. So combination of all these, so there is no single factor in here. You see all of these environmental factors, pathogens, toxic chemicals, food antibodies, inflammatory cytokines, chemokines, and many others, all together causing amyloidogenesis or plaque formation.
Great. So let's put this one down for a second, because I think it's going to be really, really useful when we talk about the end of this video, which is what you can do about it. Why don't we go back to the V factor and really talk about, you discussed all of these different categories of things that contribute to oxidative stress in the body. So again, infection, foods that you might have immune reactivity to that you don't know about, toxic chemicals like aluminum, mercury, other heavy metals, phthalates, things that we're all exposed to, especially if you live in a city, we're all exposed to on an everyday basis. They contribute to this oxidative stress. The next step in this V factor is a lack of movement and physical activity, which for those of us living in the rat race of urban life in the United States and across the world, this has become something that I think too many of us take a part in. Stressful events and depression. I think this is a really, really important part in that emotional stress really plays a tremendous role, not just in Alzheimer's disease, but in all inflammatory and autoimmune diseases.
Yeah. Just let me just say something in
Please.
here, because I was listening to a psychologist or psychiatrist about 4 weeks ago in one of the lectures. He was saying that stress causing regress. Okay, so in this case, regress in brain function.
Yes. So sometimes stresses in life are unavoidable. I think it's not a message that you have to go, live in the middle of a forest and, take yourself away from everyday life. But these are conscious things that we can all be aware of and incorporate things in our daily life to help us cope with stresses of living in the lives that we live, right?
Yes.
The next part is a high carbohydrate diet and a change in the gut microbiome. So you're talking about the food that you eat and its interaction with the bugs that live inside of your gut having an effect on your brain.
This is the most important factor because during past, let's say 10, 15 years, at least more than 10,000 articles published in the scientific journals connecting the good bacteria to good brain health,
Yeah.
and the bad bacteria in the gut to the bad brain health. So therefore, the bad bacteria, which is fed by mainly carbohydrate diet, has a devastating effect on the brain function, including destruction of the neurons.
Right. So treat your gut like a garden as well. Give it the right food. Eat organic foods. Eat healthy. Try to avoid processed carbohydrates. The bacteria in your gut will flourish, and that has a positive effect in protecting your brain.
Absolutely.
Great. So the next part is entry of bacterial toxins in circulation and activation of the innate immune response. Now that's a very technical description. For those of us that are healthcare practitioners out there might understand that, but in layman's terms, what are we talking about here?
Okay, we're talking about that on the surface of our lymphocytes,
Yes.
there are antenna-like material.
Okay.
So when these toxins are released by the bacteria, by the bad bacteria, activating those antenna, and the cell becomes activated and releases all kind of factors causing inflammation in the body. And so therefore, those antenna made actually to protect our body, in this case, they're overreacting to these environmental triggers, to the bacterial toxin, releasing pro-inflammatory cytokines, and when those pro-inflammatory cytokines get to the brain, causing inflammation in the brain and contributing to destruction of the neurons.
So again, evidence that the health of your gut and is integral to the health of your brain. So taking care of your gut is taking care of your brain. And this is not an idea anymore, but something that has been absolutely validated in the scientific literature by evidence.
Yes.
So the next part is breakdown of the blood-brain barrier. So many are probably familiar with the gut-blood barrier, right? A barrier that we have that serves to protect us from all the things that we're exposed to in our intestinal system, from touching something and then touching our mouth, from the foods that we eat being, maybe having some bacteria on them, and also allowing our nutrients to pass through the barrier when we want them to. We have this very regulated gate in our gut, but you're saying that also exists in the brain.
Yes. So we mentioned earlier that the gut barriers or breakdown of the gut barrier is the gateway or immunological door to autoimmunities. And now we are talking about blood-brain barrier, when breakdown in blood-brain barrier is gateway or neurological gate to autoimmunity in the brain or neuroautoimmunity, including Alzheimer's and Parkinson's disease.
Okay, so why don't we talk about, very briefly, what are a few things that can cause your blood-brain barrier to open then if it's supposed to be closed?
Yeah. Well, we already talked about bacterial toxins.
Yes.
Are main factors. You remember from Dr. Tanzi's presentation from Harvard Medical School that showed that the lipopolysaccharides, the bacterial toxins, were detected in the brain tissue. Not only Dr. Tanzi, also another group from UC Davis, who not only detected the bacterial toxins in the brain of some healthy people, very low amount, but much higher level in the Alzheimer's brain. Furthermore, they detected E. coli, salmonella, and other bacterial gut in the brain. So therefore, that is telling us that these bacterial toxins can break the barrier, open the door, which is supposed to protect us, And other than allowing nutrients such as glucose and others to get into the brain and feed the neurons, now unwanted toxins and even the whole bacteria can cross those barriers, and of course when they cross those barriers cause damage to the neurons. So bacterial toxins, toxic chemicals,
Yeah.
pesticides, herbicides, and some inflammatory markers also can open the blood-brain barriers, and therefore...
What about physical trauma?
Oh, absolutely, You were more involved in sports, right? You were playing football.
So if you maybe played some sport where you had even micro-repetitive injuries to your head, like a soccer player, or maybe even a football player who only played in high school, that chronic repetitive injury is enough to open the blood-brain barriers.
Absolutely, yes.
Okay.
Yes.
So these are very important things to think about,
Yes.
right?
Yes.
Maybe if someone had a history of a significant car accident, fell down the stairs 10 years before, these are all things that need to be mentioned and taken care of because they can be the event that leads to the opening of the blood-brain barriers and therefore leads to the gateway of Alzheimer's disease,
Yes.
right?
Yes. Very well said.
So the next part of this is microglial activation. So microglia, you and I think, we feel that we practice in the field of autoimmunology, right?
Yes.
And one of our colleagues and dear friend, Dr. Yehuda Schoenfeld, is probably one of the leading experts, along with yourself, in the field of autoimmunity. Now, the brain has an immune system,
Yes.
right? It's very different than the immune system in our blood. And the microglia are part of the immune defense in the brain.
They're equivalent to the macrophages. In the blood, the microglia are equivalent of the first line of defense or macrophages in the brain.
Right.
So when they become activated due to some of these environmental factors, bacterial toxins, the whole bacteria, herpes virus, Borrelia burgdorferi, other spirochetes, they become activated and release all kind of factors in order to protect themselves, but in the process damaging the brain cells, resulting in Alzheimer's disease.
And then we have the next step, which is entry of Th1 and Th17 into the central nervous system. Now, Th1 and Th17 are branches of the immune system, correct?
That's right. Yes.
So we're saying that these specific parts of the immune system can then make their way through the blood-brain barrier and enter the nervous system tissue.
As you know that these Th1 and Th17 have protective role. But when they become overactivated and manage to cross the open blood-brain barriers, they become like Pac-Mans and attacking the neurons, causing damage to the neurons, release of neuronal cell antigens, and then immune system react to that, making antibody against them. Now the antibody is going to attack further the brain cells, and this vicious cycle of autoimmunity against brain cells continues.
So that leads to the next step, which is neuroinflammation, neurodegeneration, neuroautoimmunity. Any one of those three things, all three of those things are contributing to diseases like Alzheimer's disease and contributing to other neurodegenerative diseases as well, correct?
Yes, correct.
Okay.
Absolutely.
When we talk about Alzheimer's disease, because it is the most common of the neurodegenerative dementia-like diseases, but there are several others, and they all share a very common mechanism.
Yes. So the first part of the V is complete now,
Yes.
right? So then some individual may ask, where is the proof for all of that? So you hold on to this. So I would like to share some articles, if you don't mind, very, very fast.
Okay. I think that the point here is that everything that we're talking about has been very much validated in the scientific literature. This is backed by evidence. They're not ideas at this point. I think they are firmly planted in science as being validated.
So very quick. These are just about 20 or 25 different articles I selected from our library of about probably 500 articles. about the role of environmental factors in Alzheimer's disease. And here, just very fast, few titles I'm going to read. Microbes and Alzheimer's disease, 33 authors from major institutions wrote this editorial
Yes.
about microbes and Alzheimer's disease.
And this is in the Journal of Alzheimer's
Journal
Disease,
of
which
Alzheimer's
we have
disease.
also recently
So do
published.
me a favor, if you want to read more about, go to the Journal of Alzheimer's Disease, International Journal of Alzheimer's Disease, archives of Alzheimer's and Alzheimer's disease, Alzheimer's and Parkinsonism.
Yes.
So there are many, at least there are 10 to 15 different scientific journal articles. So another article, Alzheimer's disease, peripheral infections, the possible contribution from periodontal disease.
Right.
So there is a very interesting chapter in the field of Alzheimer's, which they connect oral pathogens to Alzheimer's disease. And why this is so important? Because oral pathogens are very close to the brain.
Right.
I used to think that oral pathogens release toxins. The toxins goes to the gut, opening the gut barriers, to the blood, opening the blood-brain barriers, now into the brain.
Right.
Now we have the evidence, no. Some of these oral pathogens directly through the nose and through the adenoids directly can open the blood-brain barriers and go to the brain and cause damage.
So the take-home message from that is that your dental hygiene and dental health is intimately important to your brain health as well.
Yeah. So article after article, they talk about that. And then the gastrointestinal tract microbiome potential link to Alzheimer's disease. So now we are talking about oral pathogen, gut bacterial pathogens, herpes simplex. Dr. Izaki, many years ago, almost 30, 35 years ago, she was telling the scientific world that herpes type 1 playing a significant role in Alzheimer's disease.
Right.
And not only they did not pay attention to her, everybody started criticizing her. And unfortunately, that happened again and again with H. pylori and many other diseases. The scientists who were pioneers in the field, instead of giving credit, they were criticized significantly. So these articles, if I don't want really to go through each one of them, but they're talking about chlamydia, spirochetes,
Right.
especially Borrelia burgdorferi. In several articles showed that in 20% of the brain of Alzheimer's disease patients detected the whole spirochete, Borrelia burgdorferi.
Sure. It's a very big percentage.
Yeah, it's huge percentage. So they found HSV1, they found chlamydia, they found spirochetes, they found many other, the gut microbiomes, E. coli, salmonella, the bacterial toxins. All of these articles are showing that that some of these pathogens are involved. We don't have the evidence that really, whether or not directly, these pathogens causing Alzheimer's disease, but they are associated.
Right.
And this is huge difference,
And
right?
a big part of our research in our 3 articles was trying to understand the mechanism and with these associations, right?
Right.
So we'll talk about that very soon. I'd like to continue talking about the other side of the V factor.
Just very fast, because I have similar number of articles that talking about this.
Okay.
Okay, talking about the environmental toxins, which we should pay attention to. Example, mercury plays a role in Alzheimer's disease. Or talking about aluminum. Aluminum
Right.
as being neurotoxic. This is exact word used in the title of this article. Aluminum is neurotoxic. If aluminum is neurotoxic to the brain, so why the chefs who are cooking right now and have programs on TV, easily they use everything cooked in aluminum, or they put fish, they put the fish in aluminum, they put it in 450 degrees. Or we put soup or whatever in a food, hot food, in aluminum, and then we consume. Furthermore, aluminum is in cheese, aluminum is in candies, aluminum is everywhere. So problem we have that everybody thinks, the scientists, most of them think that aluminum is in, aluminum is out. That's not the case. Maybe 60% of aluminum is in and out, but about 40% of that goes to the epithelial cells of the gut. That's why the gut inflammation and breakdown of the gut barriers. Certain percentage of that can penetrate and goes into the brain. And they found high levels of mercury, high levels of aluminum and other toxic chemicals in brain of Alzheimer's patients. So we have similar number of articles to discuss all of this. So this is real science, and unless we pay attention to these environmental factors and remove them from the environment of the patient, the patients with Alzheimer's disease may not improve.
Absolutely. So I think the real importance of our right side of the V factor in discussing all of these steps is kind of clarifying these are pretty big categories: foods, pathogens like bacteria and viruses, environmental toxins like aluminum and mercury and plastics. These are big categories, right? And in each individual, your particular exposure to each of these categories is unique. So we need to come up with ways to start identifying through all these different environmental exposures which ones are specifically contributing to an individual's Alzheimer's disease, or potentially contributing to their Alzheimer's disease 20 years from now, right?
Right.
So that's where I think Dr. Bredesen and a lot of other neurologists who have been practicing in this field have really changed the mindset and taking this idea of the right side of our V factor and trying to understand how you can figure out which particular areas are playing a role in the patient. And when you do that, you remove those exposures as much as you can, you heal the body from those exposures, and you can either stop the progression of neurodegenerative disease like Alzheimer's, or in some patients you can actually reverse it.
Yes.
So that's the first step, the really, really important one. Figure out which one of all of these environmental factors are contributing to the disease, remove them. The next parts of, that's the bottom here of the right side of the V factor, right? And definitely the most important part of the treatment side of things. Next one you have here is low impact exercise.
Yes.
So that's the second most important thing that anyone out there who might be suffering from Alzheimer's disease might do, right?
Yes.
So
Yes.
low impact exercise is walking, right? Some light resistance work with some light bands, some gentle yoga. I was reading some data that said that if you walk 4 to 5 times a week, it's the most protective factor against Alzheimer's disease occurring. Simply walking 5 times a week for 30 to 45 minutes can protect you a tremendous amount from something like Alzheimer's disease.
Yes, but if you tell a patient you have to walk, they may listen to you or they may not listen to you. But when you tell them that walking, enhancing production of growth factors in your brain. What are growth factors in the brain? We need growth factors like the vitamins, and you remember the green forest,
Yeah.
right? You need those vitamins to enhance regrowth of neurons.
Right.
Because, as you know, there is a balance. Sometimes we lose neurons and then we regenerate neurons. So if you want to regenerate neurons, you have to have the growth factors. And so therefore, walking, enhancing production of growth factors, contributing to regrowth of neurons, and now your brain becomes like the green forest.
So let me get this straight. The idea in the past that when you lose a cell in your brain, you can't recover it, that has been proven incorrect.
Yes.
That there is something that we have called neuroplasticity, which is the ability for the brain in the right conditions to regrow brain cells that are lost. So that's what we're talking about on the treatment side of things. Once you remove the environmental factors that contribute to the loss of neurons in your brain that present with Alzheimer's disease, you do all these things to heal the body from that exposure and then encourage the cells to grow back. One of those biggest factors is BDNF, right?
Yes,
And walking
yes, yeah.
Contributes.
Brain-derived neurotrophic factor. I call that, brain growth factor.
Right. So that's the major one that walking has been shown to increase that production. So you can actually regrow your cells if you walk 5 times a week.
Yes.
The next part here is enhancing neuroplasticity. What can you do to encourage those cells, if they do grow back, and encourage the cells that you have to function at a more effective rate, right? Get your cells working better. And what we have listed here is yoga, meditation, and brain games, right? So your brain is like a muscle. You need to do whatever you possibly can to train it to work at its maximum capacity. And if you're going to do all these things to grow more cells in your brain, you also have to train them, right?
Yes. Yes.
So any of those, yoga, meditation, brain games. In the brain game world, there are several options. Elevate, luminosity, there are several
Playing
of
cards, reading books.
Right. Any type of brain games are really something that someone, if you are suffering from Alzheimer's, or if you even have a family history of Alzheimer's, something that you should do on a daily basis, right?
Yes.
So our next part here is something that I'm a huge fan of, and I'm a huge fan of it, I think, because of all the research that you've shown me that shows that it works, is something called glutathione, right? Now, glutathione is an amino acid that is essential for several things. It's essential for antioxidant support, so fighting all of those oxidative stresses that we discussed in the first step, right? And it's a really essential amino acid in supporting liver detoxification, right?
Yes.
And on top of it, it can actually help heal broken blood-brain barriers.
Yes.
So we get
Yes.
3 really incredible benefits from glutathione in that you are healing from oxidative stress, you are helping the liver excrete all of those toxic chemicals that we talked about, and if the blood-brain barrier is actually damaged, you can help heal it and patch those holes.
And furthermore, can help to remove some toxic chemicals from the tissue, including the brain.
Right, absolutely. Now, our next step here is something that a lot of people might have thought about in relationship to heart health, but maybe haven't made the connection to brain health. And that's fish oil, high-dose fish oil, a clean, good quality fish oil with a little bit more EPA than DHA, and we typically say that you should be taking somewhere between 2 to 3 grams of a high-quality fish oil every day. Other high-quality fats, including avocado oil, a clean, high-quality olive oil, and I know
Yes.
you're a very big fan of good
yes.
olive oils.
I am, and I believe that we should use absolutely pure olive oil, because if olive oil is mixed with other oils, unfortunately, probably can happen in 60% of the cases.
Yeah.
Then not only we are not helping our body, we are going to have the bad oils in our system, which can damage our immune system and our brain.
I love Italian people, and this is no offense to any Italians out there, but there has been a lot of research into Italian olive oil that has been exported over here to the United States as almost all of the time not being 100% olive oil and having a lot of other things like canola and corn oil mixed in there. So reliable olive oils are Spanish olive oils, and there are a lot of California olive oils which are very high quality, and you need to make sure that they're in dark glass containers, because the essential vitamins in olive oil, the polyphenols, are very sensitive to light. And you also want to make sure, if it's a good olive oil producer, it has a production date labeled on the bottle so you know when that olive oil was produced and how fresh it might be, because the fresher the better.
Absolutely,
Right?
and 1 or 2 spoons a day.
Yes.
You can add it to your egg or you can add it to your salad and enjoy it.
It's one of my favorite things to tell my patients. Be very generous with your olive oil. I think everyone loves that advice, right?
Yes.
So the next step here on the right side of the V factor are prebiotics and probiotics. So we're talking about taking healthy bacteria in capsule form and also giving them the food that they need to survive, correct?
Yes.
And as we mentioned on the left side of the V factor, your gut health is so important and so vital to your brain health. Both prebiotics and probiotics, so the good bacteria and their food, are absolutely essential to supporting your gut health and therefore supporting your brain health.
Yeah, especially any product contains butyrate, propionate,
Yes.
and others, can feed bacteria to release the good factors, to repair the gut barriers, to repair the blood-brain barriers is extremely helpful.
Now you have your own homemade solution of prebiotics that you take every day. Would you share with everyone what that is?
Yeah, so I take my probiotics every morning, but with that, I am taking some flaxseed, ground flaxseed with psyllium,
Okay.
mixed together with coconut oil, coconut water, coconut milk, or almond milk, and just have it,
So that's
before my breakfast.
That's a lot of prebiotics there that can give all those good bacteria that you're taking in the probiotic everything they need to live and survive in a healthy way inside
And
your
also
gut.
sometimes I add to that some special fruits which have high levels of antioxidants. Blueberries
Okay.
is one example, and others because I want to make it, a little bit, to taste a little bit good and enjoy it as well at the same time.
Well, your brain is still doing pretty good, so whatever you're taking, I'm going to take.
Thank you.
Now, our next step here on the left side of the the right side of the V factor are two things that we might think of as a vitamin, but are actually hormones. So the first one is vitamin D,
Yes.
and the other one is melatonin.
Yes.
How interesting. So vitamin D is something that I routinely test on every patient that really walks in my doors, because vitamin D insufficiency is something that is so rampant in patients. Even though we're living in Southern California here and we're exposed to sunlight, so many people are vitamin D deficient. So vitamin D supplementation is really something that has been shown to help all inflammatory diseases, all autoimmune diseases, heart disease, and now also Alzheimer's disease.
Yes. And the immunological mechanism behind that is that we have a type of cell called regulatory T cells, Treg cells, in the gut and in the blood. They are some kind of guards in our body. When something is in imbalanced form, the Treg cells, like a policeman, try to turn the balance back to the normal, not to the right and not to the left. So Treg cells have receptors for vitamin D, receptors for vitamin A, and cruciferous vegetables. So when we consume vitamin D, vitamin A, cruciferous vegetables, activate the Treg cells and balancing our immune system, repairing the gut, repairing the blood-brain barriers, and preventing any damage to our tissue, including the brain.
And I'll make a comment also about melatonin, because melatonin is a very common supplement that many people take for enhancing their sleep at night. But melatonin in small doses, 2 milligrams to 3 milligrams a night, also has a very powerful effect in modulating the immune system as well, right?
That's
Just
right.
like vitamin D does, which is really fascinating.
Yes.
Our next step up is one of my favorite categories of supplements. And so we have resveratrol, curcumin, ginkgo biloba, quercetin, and ECGC, which is an extract from green tea.
Yes. So enjoy your matcha.
I do enjoy my matcha. So these are all supplements. They're all phytonutrients that really have a tremendous effect on many of the parts of the immune system, decreasing autoimmunity, healing inflammation in the brain, and also have an effect in restoring brain-derived neurotrophic factor and increasing cell growth. We also have some other supplements here: alpha-lipoic acid, L-carnitine, CoQ10. These are all very important for the energy production of the cells in your brain, which is why we recommend them. And then Chinese skullcap and nicotinamide riboside, two of my favorite supplements, both very, very easy to find. Chinese skullcap is an extract from a plant. Nicotinamide riboside is an enzyme that is involved in vitamin B3 synthesis. Both very well proven to increase this brain-derived neurotrophic factor and help your brain regrow cells. So, to recap things, we have our V factor here. We discuss all the different steps in which an individual environmental exposure can contribute to neurodegenerative disease. And we have on the right all the things that you can do to kind of help your brain recover from those environmental exposures and help heal your brain and restore brain function.
Yeah. So if you are interested in prevention of Alzheimer's disease or stop progression of Alzheimer's disease, go to Dr. V, because Dr. V understands very well the V factor and the factors that contribute to Alzheimer's disease on one side, and the factors that can prevent Alzheimer's disease in the future.
Yeah. I'll close with our episode with a couple of comments, because I think this is really something that is so important. And thank you for being here and sharing your expertise in this. You know, Alzheimer's disease today affects 5 to 6 million Americans. That's a huge number on its own, but as we talked about, it takes 20 years until you know about those symptoms. So projections are that in 20 years, Alzheimer's disease on its own is going to render Medicare bankrupt. That's if no other diseases occurred. That's if we didn't have diabetes, if we didn't have cancer, if we didn't have heart disease, right? On its own, it's going to bankrupt Medicare. And that's because it's so devastating to the person who's afflicted by it. It's devastating to their family members. So much care is involved in those patients. They suffer from so much. I think this is the single most meaningful area in healthcare where we can make a difference, and I'm honored to be a part of it and honored to be spreading this new way of understanding disease so we can stop people from experiencing such devastating symptoms down the road. So the message is, you can figure out which one of these environmental factors are affecting you or potentially affecting you now. If you have a family member who has ever been affected by Alzheimer's disease, there are a lot of genetic factors that can predispose you to having it as well, which makes this even more important. You need to get checked early. Do not wait until you're 70 years old. When you're 50, go to a functional medicine doctor that has been trained in understanding these specifics. I myself have been trained by Dr. Bredesen's MPI Cognition Group and am certified in doing this. Get yourself checked. It's a relatively small time and money investment that could really pay tremendous dividends for the rest of your life in preventing this horribly devastating disease from affecting you in the future. Dr. Vojdani, thank you so much for being here. I really appreciate it. In our next episode, we're going to talk about our 3 research projects and how they pertain to our work in trying to more easily detect these environmental factors.
Thank you again. So just 30 seconds. For those who do not believe in some of these factors that we mentioned on this, on the left side of the V factor, also I have similar number of articles that I chose only about 10 or 15 of them in here. Please go to the Journal of Alzheimer's Disease and other journals. Every single factor which was mentioned in here, there are 5 to 10 different articles published in the scientific journals. And so whatever we presented to you in this episode is all scientific-based and evidence-based medicine.
Fantastic. Thank you so much for your time.
Thank you.
Thank you all for watching.